and I'm a clinical facilitator here in the Mash Private. I've worked here for close to 2 years now, and I have to say I really love it. My background is originally in max fax and plastic surgery. I worked in St James's after I qualified, and I came here in 2019. I worked in a ward specialising in cardiology and urology surgery. It's an area that I didn't have a whole lot of experience in, and I have to say I didn't think I'd like urology as much as I have, so delighted to have been proved wrong. I chose Mater Private because of its reputation in clinical excellence, excellent patient care and experience, and also for its commitment to looking after staff. Career development and progression is extremely important here, and it's really a focus of what we're all looking for. It is a non-teaching hospital, but regardless of that, there is a focus on ongoing education and development of staff. There's a great sense of community here, and as you pass people in the corridors, they're friendly, they're welcoming, everyone says hello to each other. What kind of stands out most to me, I suppose, is how visible the director of nursing is and how visible the assistant directors of nursing are as well. They're always on the floor. If you pass them in the corridor, they know your name, they know where you're working, and they know how you're getting on, which makes it feel like a kind of a family almost. I have to say, overall, my experience here has been really positive, and I definitely recommend it to anyone who's thinking of making a change. As I said, there is a great focus on teamwork, and everybody, regardless of the grade, is willing to lend a hand in times of crisis. We do have yearly performance reviews where we discuss our goals for the coming year, and if there's anything in particular that we'd like to try and achieve, then every effort is made to facilitate that. My own personal goal was to develop a little bit more in my urology side of things, to develop my skills and my knowledge, and I said this to my manager, and it was facilitated by allowing me to go down to theatre and observing a robotic prostatectomy in there, which is something that you wouldn't necessarily get the chance to do in some of the other hospitals. I also got the chance to work with the urology nurse specialist down the clinic. I worked with them for about 2 to 3 weeks down there, and I saw patients pre-op and post-op, gave them education about their procedures, reviewed them then afterwards, and then when they came back into clinic for their post-operative review about 2 to 3 weeks later. I was also involved in training patients how to self-catheterize themselves, changing of catheters and bladder installations, which really helped me to progress and develop my confidence in urology, which is a kind of a full circle moment, I suppose. The specialist nurses are fantastic in the hospital. We have loads of specialities, from cardiology to urology to oncology, just to name a few. And with all those specialities come a lot of nurses. They're a great educational resource to everybody in the staff. They're more than happy to do on-the-spot education, and they will come down and walk you through any procedure or protocol or anything that you're unsure of. So they really are a valuable educational resource for everybody in the hospital. I suppose also here, a difference to the public sector is where you're working more closely with the consultants. You get to liaise with them directly. There's no kind of registrar or intern to go through. So it's not as intimidating as you think. They are quite friendly and they are approachable, and they are really helpful for giving you ongoing education as well. As I said earlier on, ongoing education and development is really important. We run weekly education sessions on a Wednesday, which is where specialist nurses, facilitators, or nurses who are confident in any topic can come and present, and it helps to share knowledge among colleagues, and it's also more approachable if it's somebody that you know. The facilitators then, we run regular training courses, so we have cannulation at the moment, venipuncture, ECG training, telemetry training, and there just to name a few. We hope to do many more in the future. We also have a new graduate nursing programme, which is aimed at graduates who are less than 2 years qualified. They can come to the hospital, they stay here for a year, and they rotate to 3 different areas after 4 months in each. And then afterwards, they can decide what area they'd like to go back to. It's an extremely popular programme, and it's now in its 10th year, and we generally tend to retain our staff afterwards. So I suppose, what can you take away from that? Why do you want to work in the Mater Private? It's a welcoming, friendly institution with a great focus on growing our own nurses, career progression and development. It really is a supportive environment, and I hope that you choose to join us.